Good morning, everyone. Very happy to see you come out for this important event. Would like to, on behalf of 3IE as well, appreciate this joint collaboration with the Sehgal Foundation. And as Mr. Pandey was saying, we are hoping that this is actually going to be a day of dialogue, not of you all listening to some panels and sort of taking it in, but you all have experiences and questions in this area, and hopefully we will have an interesting dialogue. One of the thoughts I had this morning is the amount of time. I'm very excited about research transparency. But when I talk to a lot of people, I sort of see their eyes glaze over. It's like, what is this? It sounds very boring. And I thought this is probably because for a lot of us, research is something that is happening out there, to something that is done on the ground to some poor communities or something like that. But think of this sort of fictional or theoretical scenario where tomorrow you go to your doctor and she tests your urine, takes sample, she tests your blood, and you never hear back from her. Or, if they're a bit advanced, they say, look, you'll find you can just log in and you can find your results online. And, you try everything, or you don't have access to the internet, or you do, but you still don't find it. Okay? Now, imagine this is even more theoretical. A few weeks later, you go to some event, you meet a researcher, and this person says, oh, Ms. Gaarder, sorry about your anemia level. It's not good. It's okay, I didn't know this, how come this person knows it? And then, lo and behold, 3 years later, there's a publication coming out by your dear medical doctor that you had gone to, and providing insights into some treatment and discussing the benefits of iron supplements. And suddenly you realize 3 years later that you were part of a control group. And you're thinking, wow, it would have been interesting if maybe some other researcher would have had access to these data a bit earlier, or even if this researcher might have made these data and this report public a little bit earlier. Now, I know that iron supplements, it's kind of known that they're working, so my example doesn't work all the way through, but you get my point. So if you think about this is you, each of you, and if you think about it, what's your gut feeling? It feels unfair, right? It infringes your rights. It's not ethical. It's immoral. And so that's really some of the discussions we're going to be having today. Some of these dilemmas are the kind of things that we will be discussing today. So to me, research transparency and open access to data, it's about just these things. It's about rights, fairness, ethics, and moral. From that point, I want to turn over a little bit to my institution, 3IE, the International Initiative for Impact Evaluation. I don't know how many of you have heard about us. Anybody heard about us? Oh, there's a few. At least the 3IEers should have. So we are an institution that is dedicated to development research. We produce and we share research on what works, for whom, why, and also at what cost. And this is focused on research in low and middle income countries. And we do so not because we care about journal publications. Right. We do so because we want this to inform policy decisions, program decisions on the ground. Because every dollar badly spent is a life that wasn't helped or a life that wasn't changed. So that's what motivates us. From what I understand, the Sehgal Foundation was about 10 years older than we are. I think you said yes. So we are junior to you. We were created in 2008. So this is actually our anniversary event, 10th anniversary event. Sorry, this year. Very very happy to celebrate that. And since the beginning, we have been very dedicated to open data, to research transparency. And in 2008, that wasn't obvious. We were at the forefront, I would say, of this movement. We required our grantees to make the data they collected with 3IE funds publicly available on our 3IE data repository. We created a registry, which is called the Registry for International Development Impact Evaluations, and we fondly call it RIDE because it's a bit shorter. This ensures that all development-related impact evaluations conducted in low and middle-income countries, including those using quasi-experimental evaluation designs, have a place to register. And since the early days, we also created the Replication program, which is focused on improving the reliability of impact evaluation results. Because quite often you will see that impact evaluations lead to findings that actually have real impact on guidelines. We have examples of WHO guidelines that have been basically very much based on one or two impact evaluations. When you go and replicate them, you might find that they are not very robust. And so, for example, our replication program has been dedicated to this. Now, this sounds all good, but when we started with these three areas, it had some pushback. So, for example, while most grantees actually, were happy to sign contracts where they say they were going to share their data, later on, when it actually came to the fact that their studies were finished and they realized we would hold them to that 3 or 4 years later, suddenly they realized what they signed and they weren't all of them that happy. So there was a lot of pushback in the early days. Similarly, on RIDE, we found that because we hadn't made it compulsory, a lot of people, a lot of researchers were not registering. And similarly, a lot of researchers, when we asked them for their data because we wanted to replicate their studies. Now, of course, first of all, it's a bother when you asked for the data, especially if it's several years since you did your study. So I have full sympathy. But there was a lot of pushback when somebody's sort of coming after you and seeing, how robust your evidence was. So skip forward 10 years. So we're now 2018. It's a very different scenario. In the recent years, there's been a strong movement in the research community towards improving the standards of research transparency. You have a number of renowned academics have been pushing journals, funders, to be requiring more openness and research transparency. Moreover, a number of funders and key funders actually have all enacted policies related to timely and free public access to data and research. To name just a few, but it's a long list. You have the Department for International Development in the UK, DFID, the Gates Foundation, Hewlett Foundation, the EU. There's been a strong movement. And in 3IE, we are fully embracing this movement towards improved research transparency. And what we've done this year at our 10th anniversary is actually to take our commitment to the next level. And so we introduced our research transparency policy in 2018. So let me talk a little bit about what 3IE means by research transparency and what we require of our grantees. So, for example, we in 3IE require that all IEs financed by 3IE must be pre-registered in our RIDE, in our Registry for Impact Evaluations in Development, in International Development. As I said, now we're requiring it. It used to be more voluntary. And why do we want pre-registry? It's not to torture anyone. It's basically for everybody to be able to know, okay, here's a study, here's an area where there is a study that is going to be carried out. Is there something we can collaborate on? Should we avoid duplicating because, you know, research funding is scarce? So that's the reason we want to do that. And by the way, it's a pre-registry is obviously for these impact evaluations. 3IE is also dedicated to doing systematic reviews where we synthesize all the primary rigorous evidence in an area in one synthesis. Some of you might have heard about meta-analysis and systematic reviews. Meta-analysis is a type of systematic review. Well, in the systematic review space, a pre-registration would be, for example, the title registration. Again, sort of a signaling that, hey, here's an area where we're going to carry out research. A second requirement is to register the pre-analysis plan before the research starts. Now, why is that? This, to me, is what I usually call the tying the hands to the mast. You know, I don't know if anybody here is a sailor or something, but it's not good. You know, you go down with your ship if that happens. But the idea is basically that we want to, you know, you've said you had an hypothesis and you had something you were going to use your research grant on. And there's a demand for that, you answering that question. And we want you to be kept to that. That's what we want you to research. Now, if there are good reasons for you to change it, let's log that, let's have that information. But let's not have what we often see in research, you know, we didn't find much interesting here, but the data are showing an effect over there, so let's change the hypothesis. And that's what we want to avoid, and we want to, because that goes together with these issues, for example, of publication bias, as I'm sure you all heard about, where, you know, all researchers want ideally to publish on something that is actually having an effect, preferably positive. Then, thirdly, we are requiring that the replication, so that the researchers have to deliver to us the data and codes, and we will independently replicate, so that all the evidence, all the results that is in their reports, in their studies, we will make sure that they replicate. And in fact, interestingly, I don't know if some of you might have seen, there's been an article recently by Paul Gertler where they looked through a lot of the journals that actually are collecting data and codes, and they actually try to replicate those. And those are, you know, many didn't even have that, but those who actually had delivered data and codes, and I think it was 1 out of 8 that replicated fully. So just producing this is not enough security that actually this is the data and the correct data and code behind the results. We're also dedicated to transparent reporting of study design, analysis, and results. And part of this is also sort of our reports have templates that sort of require you to tell much more about also, it's not your typical, your typical publication is kind of limited to sort of 15 pages, and there's usually very little on context and details on design. Well, our reports in 3IE, they will all have much more to sort of understand the context and what sort of were the decisions taken during the research, as well as policy implications of the findings, etc. As I mentioned, we also require open access to the data and the codes. Some of this is also, by knowing this ahead, researchers are actually also, this is maybe something that is worth researching, but the assumption is that you will, if you know you will require to hand over your data and codes, and people will try to replicate your study, you will take more care in your study. So by doing that, the quality is likely to be better. And not only that, but we are very dedicated and interested in reuse. I mean, these are, part of it is just ethical. You don't want to start, if you have enough data on something, you don't want to sort of have multiple rounds of surveying the same people if you can help it, right? And so making these available, making them usable from some other researchers, so it needs to be cleaned. This is all part of being cost-effective and ethical. Other things that we sort of ensure in our grants is around adhering to appropriate citation standards. And of course, all our reports are open access and available to the public. Let's see if this works. Not going to say much, just to show you that our research transparency policy was, it shows up as initial version in April 2018, and you can find it online. It says initial version, but partially because, well, it is. It's a live document for which we actually would welcome if anybody has ideas or had views about ways to improve it. We would definitely welcome that. Here is the RIDE that I mentioned to you, the Registry for International Development Impact Evaluations. Again, it's a resource. It's available not only to, while we're requiring it for our 3IE grantees, it's also available to other researchers. And it's where, as I mentioned, you can show to the world and to other researchers, etc., what your study is going to be about. Very importantly, this is the only registry, to my knowledge, that also registers quasi-experimental designs. There are other registries, but are only dedicated, for example, to randomized controlled trials. So we're quite proud of that. I mentioned earlier the Impact Evaluation Replication Program. So again, you can find a number of reports where we have tried to replicate studies by, usually we chose them because they were policy influential. These are studies that have made a difference to a policy or a guideline by an important institution. And you will see also they're quite specific in terms of methodology, and if there are researchers out here that are interested, they would find these particularly useful on methods. Okay, so this is just to show you we have a range of reports, and they are all, these are, our latest publications are all sort of up front on our webpage, but you will find all of our working papers and reports, etc., easily available on and obviously open access. And maybe a couple so some of the things we've done since we launched this research transparency policy is that we obviously there were certain things we had to up our game in. So now we sort of become very much clearer and communicating very much strongly with our researchers and grantees up front that the data and the materials, it's a part of the grant agreement. It will be required. What we started doing recently is to, for example, even doing it around baselines. It's not only at the end, but it's also at baseline level, because that's a time where grantees get used to the idea without it sort of seeming more, threatening because you don't yet have your results. We actually, since April this year, are not making last payments to grantees, for example, until their findings replicate. So, in fact, in this year, everything that we finance and that has come out has fully replicated. We also work closely. It's not given that somebody knows exactly how to write good data and good codes that are easily replicable through push-button replication. So we work with the grantees early on to give guidance on how do you prepare your data and files so that we basically can do a replication at the push of a button, which is the ideal. And finally, we publish replication files within 6 to 12 months of publication of report on our 3IE's website. And quite often, we get them earlier. We actually get data and codes at the time of publication of the report.